start by quoting Michael Hollick. Can you imagine what would happen if a drug company came out with a single pill that reduces the risk of cancer, heart attack, stroke, osteoporosis, PMS, SAD, and various autoimmune disorders? There would be a media frenzy likes of which has never been seen before. Well, guess what? Such a drug exists. It is the sun.
Absolutely. And the reason why is because the sun creates vitamin D in your body, and the higher your vitamin D blood level, the more likely it is that you'll prevent all kinds of diseases. In fact, causes of death, all causes of death for any disease, it seems to have an association with vitamin D levels in the body.
So you wrote this book, Vitamin D, the Sunshine Vitamin, and you're a real proponent of people going in the sun, being in the sun.
Absolutely.
And not using a bunch of sunscreen every day.
That's right. In fact, the sunscreens can be carcinogenic themselves, and they prevent the body from manufacturing vitamin D under the skin. And as a result of that, I believe that sunscreens in many cases are creating vitamin D deficiency.
So what time of day do you think we should be out in the sun?
We should be out in the sun between 10 o'clock in the morning and 2 o'clock in the afternoon.
Which is exactly when they say do not go in the sun.
That's exactly when I say you should go out in the sun, because that's when the UVB rays are the strongest. And those are the kind of rays that you need in order to manufacture vitamin D under the skin.
And you had told me earlier that you found 9 out of 10 children in your practice deficient in vitamin D.
Yes, I have. Just about every child that I've ever done a vitamin D blood test on has shown to be low levels.
And in children, what would the symptoms be?
Well, in children, you get basically neurological or nervous system problems, ADD, autism in many cases. There's a theory behind autism and vitamin D deficiency. If you go on to the Vitamin D Council website, you can see a 30-page dissertation on the connection between vitamin D deficiency and abnormalities in brain development that produce autistic behavior or hyperactive behavior or any kind of childhood learning behavior problems. So vitamin D deficiency may be directly connected to that. A lack of vitamin D also predisposes you to recurrent or frequent infections, especially in children, middle ear infections, recurrent respiratory tract infections, asthma, allergic symptomatology of all types, rhinitis, eczema, you name it, vitamin D deficiency can be associated with it.
So would this be something that would be transmitted from the pregnant mother who hadn't had enough vitamin D as well?
Exactly, and now there's a movement underfoot amongst pediatricians and people that are, into natural therapies to supplement mothers, or pregnant women with at least 10,000 units of vitamin D every day.
Mm-hmm. What's the standard recommended dose?
Standard recommended dose seems to be around 800 to 1,200 international units a day, which most experts feel is far too low. And Dr. Weith at the University of Toronto, he says that you need a minimum of 4,000 units a day just to bring the blood levels up. But most people are saying you should be getting 10,000. There's actually some endocrinologists in the United States who put all their diabetic patients on 50,000 units every day. And they found that the risk or the incidence of complications is virtually zero. So most diabetics and most people that actually have diseases, taking vitamin D supplements can actually make a huge difference in terms of the outcome of the disease.
So do you think that this is true for things like multiple sclerosis, which is a northern climate disease?
Absolutely, yes. Vitamin D deficiency has been associated with MS, and many people that have MS who take vitamin D supplements, especially in my practice, I've seen this happen. They do terrific. The symptom control is terrific.
And what's their dose?
Well, I usually have them take 10,000 or more, and I do frequent checks on their blood levels. Mm-hmm. And unfortunately, I do find that people who have MS, when I first see them, their levels are low. And even after 10,000 units a day supplementation for like years, their blood levels barely stay normal. So some of them I've put up to 20,000, 50,000, even 100,000.
Mm-hmm. Boy, that's incredible. What other diseases are related to vitamin D deficiency?
Well, you mentioned MS and autoimmune diseases. There's hundreds of autoimmune diseases. Almost all of them are connected to some degree to lack of vitamin D. Any kind of inflammatory condition, arthritis, iritis, nephritis, you name it, anything with itis at the end of it usually refers to some kind of inflammation. Vitamin D deficiency is associated with more inflammation. You have obviously all the bone diseases, osteoarthritis, osteoporosis, rickets, osteomalacia, you name it, anything to do with the bones, vitamin D deficiency is involved.
You mentioned various cancers as well.
Oh yeah, at least 20 different cancers are associated with lack of vitamin D.
But then why do dermatologists keep telling us to stay out of the sun because we're going to get malignant melanoma?
Unfortunately, the dermatologists that say that are out of date. There have been some textbooks even written by dermatologists that state that sunscreens are a very bad idea, and that what we should be doing is educating the public in how to experience sun exposure. You don't go out in the sun the very first day of summer and spend an hour baking in the sun. You basically try to do it in a very gradual fashion. You start off with 5 minutes, 10 minutes, 15 minutes, and so on. And that way your body has a chance to become accustomed to the sun, and you're not going to burn. Certainly you won't burn as easily. And the darker you get, the more you'll be able to tolerate sunshine. It's interesting, people that are of darker complexion, people from Africa or from Asia who are very dark, they do not manufacture as much vitamin D from the sun. They have much more protection against damage by sun, but when you do their blood levels, oftentimes you find that their blood levels are very low, despite the fact that they may have spent hours out in the sun. So some of those people actually do need to take a supplement.
Is that because the dark skin blocks it?
The dark skin blocks the body from manufacturing vitamin D. Now they will make vitamin D, but not as much, anywhere near as much as a person of your color would.
Well, it's interesting, dietitians are telling people that you just have to drink your milk. You just have to drink your milk, eat your yogurt, and have your cheese, and you're getting enough vitamin D.
Well, that's not true. You'd need about 40 glasses of milk a day in order to get adequate. Exactly, yeah.
What about in the middle of winter in dark, dreary, rainy Toronto? What do you recommend that people do?
And the best supplement to take would be one that's called emulsified vitamin D. That's a water-soluble form of a fat-soluble vitamin, so that the absorption is very high. And somewhere between 5 and 10,000 units a day would be adequate for most adults during the winter. But I think probably a good idea to get the blood levels checked.
So better than the old-fashioned cod liver oil, which was so yucky.
Well, cod liver oil is another possibility, but cod liver oil contains vitamin A, and that may interfere with some of the actions of vitamin D. So I don't recommend it for everybody.
So you call vitamin D the anti-death vitamin?
Yeah, absolutely. Because basically it can prevent death from all causes. There was a study actually that showed that vitamin D prevents death from all causes, just any disease you can think of. And the reason for that is because vitamin D has an impact in the manufacture of numerous hormones and enzymes, and it's involved in every tissue of the body. There are receptors for vitamin D even in the brain and in all tissues in the body. So if there are receptors for vitamin D in any tissue and all tissues of the body, clearly there must be a role for it. So pretty much any disease can be prevented just by having adequate levels.
So if we're having multi-system symptoms, everything's going wrong, we don't know why we're sick all the time, do you recommend getting tested for vitamin D levels?
Oh, absolutely, yeah, I do. And it's surprising to find that the sicker people are, the lower their blood levels of vitamin D are. So, it's clearly the right thing to do.
I'm very excited to start tanning. Thank you.
You're very welcome.